Good afternoon. First of all, I don't speak English, so I'll try. I want to tell you about one method, nurse procedure. What we use in treatment of necrotic wounds. The material of this work is 105 patients with a neuroischemic form of diabetic foot syndrome with purulent necrotic wounds. A stage of diabetic foot syndrome by classification in groups. Biological paysage. It was two groups. In first study group, we use methods air plasma streams and ozone oxygenation. And the control group, it was traditional local treatment. Two devices, it's all rational devices. I know that a first analog using in the United States and the zone procedure used in Poland, and Italy, and Romania. Effects of these methods remain total caltricidal effect. We have vaporization of the necrotizing tissues and endothelium protective action. And the effects of ozone therapy, antimicrobial, fungicidal, and antiviral, immunomodulating, and so on. Methods. Step 1, 3 minutes of NO air plasma flows. And step 2, 20 minutes of ozone and oxygen therapy. Control methods, the bacteriological parameters, and proliferative activity of fibroblasts in epithelial cells. Microbial colonization of wounds in study group reduced more faster. Proliferative activity of fibroblasts in a study group 2 times faster. And proliferative activity of epithelial cells so 2 times faster. it's illustration of the fibroblast activity and in epithelial cells activity. And the results. In terms of the wound healing, for this patients in study group, first months are healing 85%, and in study in the control group, most of them late of 2 months. Relapse rate of infection complication in study group 5%, and our control group 23%. So it's a good method for debridement of purulent necrotic wounds. And we use this method not only in the treatment of diabetic foot, but also other wounds and wound infections. It's my unit. It's our nurses. Thank you.
Thank you. Interesting study. Just got a question. Do you use no air plasma as a debridement method just to proceed with healing, faster healing?
Yeah.
And I couldn't, follow. Is it for any age, any whether gender? We need to check whether the healing process is okay and is effective, and it doesn't matter the age, it doesn't matter the gender.
No, we use it in any age, any wounds, any type of wounds, but only in a complication wound. Necrotic, purulent, foot, head, thorax, abdomen.
Okay. So using the no air plasma after you checking is not a necrotic, is not a dead tissue. You use a Doppler machine to check whether there is blood circulation, there is a flow, before you apply no air plasma. Is that what you mean? If it's necrotic, it won't work? If it's necrotic, we cannot use no air plasma. That's my understanding. It's not for necrotic area.
Yeah.
It's
for
not.
Necrotic area, first of all, air plasma.
Okay.
For necrotic area. And ozone, that method ozone, for all kinds of tissue.
For all types of, okay, thank you.
May I ask a question as well? I'm Dr. Nigarbon, cardiologist. You said that there's a purulent food, which means there's infection, so there's a risk of systemic infection as well. I didn't get the point that whether did you use antibiotics at the same time, or you just use the ozone therapy for the purulent infection of the diabetic foot, or not?
Maybe I don't understand. We use.
The question is whether did you use at the same time antibiotics? Did you give the patient antibiotics as well? Because this is an infection, so there is a risk of systemic infection. So because if you see the diabetic foot is infected, so you can't give only ozone therapy without giving systemic infection, because that could lead to?
We, of course, use systemic antibiotic therapy. We use surgical debridement, but often we can't surgically debride some kind of necrotic tissue because it may be complicated. But this method, we use in these types of wounds.